This video will explore the anatomy, indications, techniques, and complications of tracheostomy. Topics include infection prevention, care of tracheostomy tubes, impact on communication and voice production, and specific complications such as fistulas and stenosis. The trachea is a tube in the throat that connects the larynx to the main bronchi. It has cartilaginous rings and ciliated epithelium. Understanding its anatomy is important to avoid complications during tracheostomy, such as damage to the tracheal rings or nearby structures. Tracheostomy placement is performed in various clinical scenarios, with surgical or percutaneous approaches. Surgical tracheostomy involves a horizontal tracheal incision and tube placement, while percutaneous tracheostomy utilizes bronchoscopic guidance and dilatation. Each technique has unique considerations, and proper understanding is vital for clinicians in airway management and critical care. Immediate complications following tracheostomy include bleeding, infection, damage to nearby structures, tracheal stenosis, or accidental decannulation. Prompt recognition and intervention are essential for management, including hemostasis, wound care, antibiotics, and securing the airway in case of accidental decannulation. Late complications of tracheostomy include tracheal granulation tissue formation, tracheomalacia, tracheoinnominate artery fistula, tracheoesophageal fistula, and subglottic stenosis. Prompt recognition and management of these complications are essential for optimal patient outcomes. Proper care of the tracheostomy tube is essential in preventing infections and managing associated complications. Regular cleaning and maintenance of the tracheostomy site, as well as frequent tube changes, are crucial in reducing the risk of infection. In addition, ensuring proper humidification of inspired air, managing cuff pressures appropriately, and maintaining adequate communication with the patient are vital aspects of tracheostomy tube care. This topic delves into the strategies employed for infection prevention, addressing potential complications, and optimizing patient comfort and safety. Healthcare providers involved in tracheostomy care must be well versed in these strategies to ensure optimal patient outcomes. Tracheostomy can profoundly impact a patient's ability to communicate and produce voice. Communication difficulties may arise due to the alteration in airflow patterns, phonation limitations, and impaired sensory feedback. It is crucial to assess and address these challenges to optimize patient communication and overall quality of life. This topic explores various assessment tools, communication strategies, and voice rehabilitation techniques, such as speech therapy or the use of assistive devices. Understanding the impact of tracheostomy on communication and voice production is essential for healthcare providers involved in the care of these patients. Managing tracheostomy complications requires a multidisciplinary approach involving healthcare providers from diverse specialties. Collaboration between otolaryngologists, intensivists, pulmonologists, speech-language pathologists, nurses, and other allied health professionals is crucial in providing comprehensive care to patients with tracheostomy. Effective communication, shared decision-making, and regular interdisciplinary meetings facilitate optimal patient outcomes. This topic emphasizes the significance of interdisciplinary collaboration in managing tracheostomy complications and highlights the roles and responsibilities of each team member. Tracheoinnominate artery fistula is a rare but potentially life-threatening complication of tracheostomy. It occurs when a connection forms between the innominate artery and the trachea, leading to massive hemorrhage. Prompt diagnosis and intervention are crucial in managing this condition effectively. This topic details the clinical presentation, diagnostic evaluation, and various treatment options available for tracheoinnominate artery fistula. Healthcare providers need to be familiar with these aspects to ensure timely recognition and appropriate management. Tracheoesophageal fistula refers to an abnormal connection between the trachea and the esophagus. It is a rare but serious complication that requires prompt diagnosis and intervention to avoid potential complications, such as aspiration pneumonia or respiratory distress. This topic explores the clinical presentation of tracheoesophageal fistula, diagnostic evaluation techniques, and intervention methods. A thorough understanding of these aspects is essential for clinicians involved in the management of tracheostomy patients. Subglottic stenosis is a significant complication that can occur following tracheostomy. It involves the narrowing of the airway below the level of the vocal cords and can lead to respiratory distress if left untreated. Understanding the etiology, signs, and treatment options for subglottic stenosis is crucial for effective management. This topic provides a comprehensive review of the various causes, clinical manifestations, and treatment options available for subglottic stenosis following tracheostomy. Tracheal granulation tissue formation is a common complication following tracheostomy and can contribute to airway obstruction. Early identification and appropriate interventions are essential in preventing progressive narrowing and worsening respiratory symptoms. This topic outlines the identification methods, preventive measures, and interventions employed for tracheal granulation tissue. Healthcare providers should be well versed in these aspects to optimize patient outcomes and prevent further complications. Tracheomalacia is characterized by the weakening of the tracheal walls, leading to dynamic collapse during respiration. It can present as a congenital anomaly or develop secondary to tracheostomy. Understanding the etiology, clinical presentation, and management strategies for tracheomalacia is vital in providing optimal care to affected patients. This topic explores the various causes, symptoms, and management options available for tracheomalacia. Healthcare providers should possess a comprehensive understanding of tracheomalacia to ensure accurate diagnosis and appropriate intervention. Tracheostomy is a surgical procedure to create a secure airway. Its benefits should be weighed against potential complications. Understanding tracheal anatomy, indications, techniques, and complications is crucial for optimal care and outcomes. Collaboration and effective management strategies are important in minimizing complications.